Good morning, everybody. Linda Pellegrino with you here on Senior Radio Buffalo. And as you know, we like to be extremely vital to current news and to what's going on and in ways to keep you healthy and happy. And when it comes to that, everybody is talking about COVID-19, vaccine. Are you eligible? What other treatments are out there? So that's what we're going to talk about this morning. And we're so happy to have with us from the McGuire Group, Danielle Roish, who is the assistant administrator over at the Harris Hill Nursing Facility, and Annie Spano, who is also director of nursing over at the Harris Hill Nursing Facility. And of course, as you know, associated with the McGuire Group. So good morning, ladies. Thanks for being with us.
Good morning. Thank you for having us.
Okay, let's talk about something that has come to our attention called monoclonal antibody infusions. Can you tell us what that is?
Yes, monoclonal antibody infusions are laboratory-made proteins that mimic the immune system's ability to fight off harmful pathogens such as viruses. They are specifically directed against the spike protein of SARS-CoV-2, designed to block the virus's attachment and entry into the human cells.
Is this the same as what's being given in the vaccine?
No, this is a little bit different. With the vaccine, the vaccine waits for the body to mount its own response and create antibodies, as well as to develop T-cell immunity to fight off the infection. With the monoclonal antibodies, they are infused into the patient with recently diagnosed COVID infection, and they can immediately get to work by blocking that spike protein of the coronavirus to fight off the COVID infection.
Okay, so this is more of a proactive treatment for those already diagnosed with COVID.
Correct. So this is for patients that are having mild to moderate symptoms of the coronavirus before they get to the severe aspect of the disease.
Okay, all right. So that clears that up. So obviously the qualifications for individuals to receive these infusions is that you have to be diagnosed and you're showing mild symptoms.
Correct. So there's different criteria that are indicated to be a candidate for this infusion. And that is for somebody to have a mass body index of 35% or greater, chronic kidney disease, diabetes, immunosuppressed or on immunosuppressive therapy, and for that younger population, so 55 and older that have that cardiovascular disease, hypertension, or some other type of chronic respiratory disease.
Well, that's great because that just answered my next question. My next question would have been, do you have to be a certain age to get this?
We actually have had a couple candidates that have been less than that 55, and we are approving that as well with the guidance of Dr. Nadler at DeGraff. Again, just have to have those certain criteria that are having those chronic respiratory issues and those mild to moderate symptoms that come along with COVID.
So this is now available at the Harris Hill Nursing Facility?
Correct, yes.
Okay. Now, and I also see that there's an S here on monoclonal antibody infusions. Does this mean someone gets more than one?
No, it is a one-time infusion. If you get it, you are not a candidate to receive it again.
And is this in an injection form?
It's intravenous.
Intravenous, okay.
Yep, so we hook you up to an IV, and it's given over a span of time.
That's great. What have the results been? What have the results been so far?
Very positive. So we've done a little less than a dozen people at Harris Hill, and I know DeGraff, I can't really speak for them, but they've done quite a few, and the results have been very positive, very good outcomes. Typically, the patients that we're seeing, the feedback is within that 24 hours, so the next day, they are already seeing results. They are already starting to feel better.
Wow, that's great. Would someone still get the vaccine if they've had a monoclonal antibody infusion?
Absolutely. There's no contraindication for that.
Oh, that's fantastic. So when did this become available at the Harris Hill Nursing Facility?
This actually became available at Harris Hill Nursing Facility on December 29th of just this prior year. And actually, it's important to note, too, that as well as the Harris Hill location, Autumn View Healthcare Facility has also started to offer this service to their residents.
Okay, so does one need to be a resident of the Harris Hill Nursing Facility to get this?
Yeah, so with everything that we do, we want to make sure that it's safe and that we're, kind of taking full steps. So at this point in time, for Harris Hill and Autumn View, they're actually starting live tomorrow at their facility. We are really only offering it to those in-house. This way, we have a rapport with the patient. We know what their diagnoses are, what their comorbidities are. So it's safe right now for us to just be offering it to those patients in-house.
I can understand that. Did the staff require special training in order to administer this treatment?
So yes and no. So all of our registered nurses already have the skill set necessary for the actual insertion and the infusion, but we needed to fine-tune things a little bit along with DeGraff to correlate that service with Harris Hill, just because there's specific treatments pre and post infusion monitoring that we need to adhere to.
All right, let me reintroduce you in case someone is just joining us here on Senior Radio this morning. We're talking with Danielle Roish, who is the assistant administrator over at the Harris Hill Nursing Facility, and with her is Annie Spano, who is also a nurse and director of nursing over at the Harris Hill Nursing Facility, of course, associated with the McGuire Group. And this is very interesting. We're talking about monoclonal antibody infusions, which have been given to some residents over at the Harris Hill Nursing Facility who have been diagnosed with COVID, a mild case of COVID. And it looks like so far that things are going very well. How many people have had this treatment over at Harris Hill?
Less than a dozen. I would say probably about 10 at this point.
Okay. And obviously you're monitoring these people, correct?
Yeah. So in order to be infused, there is a monitoring process. The patient is monitored with vitals prior to the infusion, during the infusion, and then after the infusion, just to ensure that there is no adverse reactions. And that's typically every 15 minutes we're monitoring that individual.
You know, ladies, why do you think that we haven't heard of any other treatments for COVID except from the vaccine so far? I've never heard of monoclonal antibody infusions before this subject came up this morning.
So it's important to mention that there's only one COVID-19 treatment designed to keep people out of the hospital, and that is this monoclonal antibodies. To say why we haven't heard of it sooner, it's anybody's guess. But now that we have it, I think it's a very important toolkit to, stop the progression of severe disease in COVID-19.
However, if somebody approaches you and asks you about this who is not a member of the facility, who is not a resident, they cannot have this. Is that correct?
Go ahead, Annie.
At this time, yes. So while, we want to serve the outside community at this juncture, yes, we just need to offer it to those that we have a rapport with, that we have a medical background on from the physician aspect. Just for safety, just to monitor those people that we have in-house before it's offered to those out in the community at this time.
Do you think
there are?
Yes, go ahead, please.
Yeah, but there are those individualized, especially that we trained with DeGraff nurses in conjunction with Dr. Nadler at DeGraff. So people do have the ability to get this out in the community, and they would need to speak to their primary care physicians and what other physicians are following them to receive this. Yeah.
Okay, that's very interesting because I think a lot of people would be interested in this. And do you think that down the road, this will be offered basically to the general public who has been already diagnosed with mild COVID?
We certainly hope so.
Mm-hmm.
As again, we believe that it's a very important tool.
That's great. And maybe you should let us know, what pharmacy does Harris Hill receive this medication from?
So the medications are prepared at request and it's for immediate use through our partnering pharmacy, which is Farm America. They are local on Union Road, so it's very close to all of our facilities. So the medication, once we get the order and once we receive who the candidate is going to be and get the paperwork going and the consent and things like that, the medication is prepared, and it is only good for 24 hours. So that's why we have to have it prepared right before. It needs to be refrigerated, and then it is delivered to our facility.
And we should let people know that this was the same treatment that was given to the president, correct?
Yes, ma'am.
And you saw how quickly he rebounded.
Absolutely.
Is right now Harris Hill Nursing Facility the only nursing home in Western New York to offer monoclonal antibody treatment?
As of today, yes. AutoView does start tomorrow, but yes, we were the first nursing home to initiate this and work with DeGraff and get the ball rolling.
Wow, that's very, very exciting, ladies. You have to be very, very happy about this to see that you're both so proactive and that this is coming to your facility and you're getting very, very good results from it.
Absolutely.
Yes, we have a wonderful team here and a lot of support from our corporate entities, and we couldn't have done it without the community support.
Wow.
As well.
Just in case people are coming in late, we just want to remind everyone we're speaking with Danielle Roche, who is the assistant administrator over at the Harris Hill Nursing Facility, with Annie Spano, who is the director of nursing at that facility as well, of course associated with the McGuire Group. And we're talking about the fact that monoclonal antibody infusions are being distributed or actually being administered over at the Harris Hill Nursing Facility for their residents. Now, these are people who have already been diagnosed with mild COVID, and this infusion, which is given like an IV, is having very, very good results. And we're hoping to see a lot more of this. But it's nice to know it's here in Western New York. And folks, if you have questions about it, by all means, ask your doctor, and they can go ahead and refer you. If you have questions for these ladies, you can call them at the Harris Hill Nursing Facility at 632-3700 or check out the main page at the McGuire Group.